Hi, my name is Lee Gunderson. This is for Nursing 660B. I'm doing an assessment on a COPD patient. How are you?
Good. Yourself?
Good. Thank you for coming in today. I'm just kind of following up on any of your exacerbations on COPD, or if you've had any problems in the last, say, 6 months since your last visit. I just kind of want to do a brief head-to-toe assessment and then ask to make sure that things are going okay for you.
Okay.
Any changes in your daily life? Any changes in your hygiene? Basically, any ability to care for yourself? Any issues with that? Any problems with finances? Any changes at all?
Just I'm finding increased secretions. It's harder to breathe. A little bit more swelling in my legs.
Okay. Have you noticed when you're taking your medications, have you noticed that you've been taking them more frequently than you have been before, or have you been pretty much sticking to the schedule that was prescribed during your last visit?
I try and stick to this schedule as prescribed.
Okay. Basically, with the treatment that we recommended last time, you do have scheduled medications, and then as you remember, hopefully there were medications that you've been taking or are supposed to be taking when you do feel like you're going to experience an exacerbation or you're around any triggers. Have you been using those, like your inhalers or anything like that?
No, I can't afford them.
Okay. Just quickly, if you could just kind of walk me through and follow my finger. And okay, perfect. And then just look at me and open your mouth up wide if you could. Okay. So like you said, were there more increases in secretions and mucus when you're coughing all the time, or do you notice that you're even having inability to lie flat when you're sleeping, having trouble positioning yourself, anything like that?
Yeah, I've been propping myself up on pillows a lot at night because I find it's worse at night.
Okay. Any other issues that you can report in terms of your oxygen? Have you been using any of your oxygen? I know that we did prescribe you a tank, but you said at the last visit that you had not been using it. So just trying to see if you've felt the need to use that, or if you felt like your symptoms have been pretty well managed.
When I get really short of breath, I'll use my oxygen and then I'll put it away when I feel better.
Okay. And overall, how do you feel today?
Today I feel okay.
Okay. I'm going to just take a quick listen to your lungs. And take a deep breath for me. And out. Deep breath in for me. And out. One more. And out. One more. And out.
Excuse me.
Hard to take deep breaths in and out?
Mm-hmm.
Okay. Just take a quick listen, if you could just relax. Okay, and take a deep breath in. Perfect. So I do kind of hear a little bit of congestion when you're breathing. Do you feel like that's normal or that's changed at all?
That's kind of my baseline.
It is kind of your baseline? Okay. Can you just take a big deep breath and cough for me? Okay. That's baseline, that long, kind of prolonged cough?
Yes.
Okay. Have you been having any problems eating, drinking, loss of appetite?
No.
Okay. How about with your stomach, regular bowel movements, any problems there? You've been nauseous, vomiting, any reaction to the medications?
No.
Okay. How about getting up and moving and your activity tolerance? How have you been doing with that?
It varies by the day.
Okay.
Some days I can get up, I'm fine. Other days I just get up a little bit slower, take my time.
Okay. Like getting up and moving and doing everything kind of within your daily routine is still okay? Or are you able to still handle everything at home?
Yeah.
Okay. And I can't remember from our last visit, do you live alone or do you live with somebody else?
I have family at home.
Okay. And they're able to help you with everything that you need?
Yeah.
Okay. Let me take a quick look. If you could, just give me your hands here. Just squeeze my hands. And let go. Let me just check. Have you noticed your fingers being cold at all abnormally, unrelated to weather, just kind of sitting there being cold? Any of your extremities or your skin, have you noticed that it's cold or feel like you're not getting blood flow to everything?
No.
Okay. You feel good to me. You look good. How about how you doing with managing your disease? I know that last time we spoke, you're no longer working. You had to take some time off of work just to be able to manage your symptoms. Have you started looking for work again, or are you still at home with your family members?
I've started looking. I just haven't found anything.
Okay. So with the support, do you feel like you have everything that you need? Do you have enough money to buy most of your medications, or just not the inhalers? Or how's your social life or your home life?
Just not the inhalers. I just don't know if I use them enough to justify paying for them.
Okay. So no inhalers, that's okay. What about in terms of rent, food, money, everything like that? You feel like you're okay?
Yeah, my family helps a lot.
Okay. What have you been doing to manage this? I know that we diagnosed you a couple of years ago. Haven't seen you in a few months, but do you feel like that you have all the support that you need? You're able to deal with this with the group and with basically with your family, your friends, your church. If you attend church, do you attend a church? You do? Mm-hmm. And they're supportive of the disease? Mm-hmm. Okay. How about psychologically? How do you feel?
I feel okay.
Yeah? Are you able to get regular sleep?
Yeah.
Get up and move around?
I know propping up the pillows has really helped, so that's increased my sleep.
How about actually getting along with your family and working with them?
Yeah, we get along pretty well.
Okay. That sounds good. What about just kind of following up? Do you feel like that there's anything that you're missing, anything that we can't provide for you, or any more resources that you do need in the community?
I don't think so.
No? Okay. So can you just once again kind of show me your feet and stand straight on the chair here? Put your feet down on the table. Do you feel like they're a little bit more swollen?
Yeah, today they look a little bit more swollen.
Okay. And still you're able to manage though without the oxygen and just with your regular medications at this point?
Right.
No, any wheezing that you report? Anything that triggers